Welcome you all again. Now let us proceed to the moderated panel discussion on promotion and protection of human rights to older persons in post-COVID-19 era. Before we begin, I'd like to give you a few announcements for Q&A session. We depend on all of your inquiries and meaningful comments. During the Q&A session, participants are encouraged to leave your inquiries and comments using the Q&A function of the Zoom. And participants who wish to ask questions, please also click the raise hand function available in Zoom. When taking the floor, the participant will be asked to turn on the camera and unmute the sound, and you could appear on LED media wall during your intervention. Also, we will refer to the comments from YouTube's live chat, so we can ask for active participation of the audience who are with us through the YouTube as well. It would be appreciated if you could leave your inquiries and comments as brief as possible. So now, I would like to introduce the moderator, panelists, and discussants. So please be advised that some of the role players will participate in the session via online. Our moderator, Dr. Kyung-Hee, member of AGAC Expert Group and former Senior Research Fellow of Korea Institute for Health and Social Affairs. We have three panelists, Dr. Eun-Ha NAMKUNG, Associate Research Fellow, Center for Research on Aging Society of Korea Institute for Health and Social Affairs. Ms. Hana BECKER, First Secretary of Political Affairs, Embassy of the Federal Republic of Germany. Dr. Nena BOEL, Counsellor of Health Embassy of Denmark in Korea. We have three discussants, Dr. Dongwoo Lee, Deputy Director, Social Human Rights Division, National Human Rights Commission of Korea. Mr. Eduardo KLIEN, Regional Director, HelpAge International Asia Pacific. And Dr. Nena GEORGANTZI, Policy Coordinator, Human Rights and Non-Discrimination Age Platform Europe. So all speakers are allowed to take off their masks only during their own speech time, and please wear it after the presentation. So now I will hand over the microphone to Dr. Kyung-Hee. Thank you very much.
네, 안녕하세요. 자장을 맡은
Good afternoon. I am Kyung-Hee, who will be serving as the moderator. And since all the speakers and the discussants have been introduced already, let me just tell you about some housekeeping remarks. Now, we will be talking about the COVID-19 situation and the implications, talking about different countries from Korea, Denmark, and Germany. And the presentation will last about 15 minutes each. Now, one speaker will connect with us via Zoom, and one speaker is here with us, and another discussant would be connecting via Zoom. And we also had some remarks about how to raise questions, but now as we understand, because of the COVID-19 situation, we have not much physical presence yet, and we have a lot of participants online or Zoom. So during the presentations and the discussions, if you would raise your questions, then we would put them together and deliver them to the speakers and the discussants for the responses. And given that the theme today is the human rights of older persons, now we also wanted to make sure that we can also encourage participation by the older persons. And at the ASEM Global Aging Center, they also have the human rights of older persons supporters. So we are receiving a lot of help and support from the elderly centers and the HelpAge Korea. So they would also be raising questions later on. So that is all for how we are going to proceed with the sessions. And with that, we shall begin. As I explained earlier, each presentation will last about 15 minutes. And the first speaker is from KIHASA, who is studying aging society, and it is researcher Eun-Ha NAMKUNG. So now, please go ahead.
예, 남궁은하 박사님 연결되어 있으시죠?
So now then, Dr. NAMKUNG, are you connected? Yes, please go ahead.
great honor to join the group and seminar and present on the promotion and protection of human rights of older persons in the post-COVID-19 era. I'm Eun-Ha NAMKUNG from the Korean Institute for Health and Social Affairs. First, I would like to present briefly about the COVID-19 and its impact on older Koreans. After that, I will present older persons' rights related to COVID-19, and in the last part, I will explore some policy and practice implications for post-COVID-19 era. As you may know, COVID-19 pandemic is ongoing with the number of confirmed cases are more than 105 million worldwide. The graph shows that the number of cases has been rising, especially at the end of the past year and the beginning of this year in Korea, and the same pattern has been shown worldwide. This pandemic is known to be more impactful to older adults. The proportion of confirmed and deceased cases are heavily concentrated to very old age. As you can see in this graph, in Korea, deceased cases of persons aged 80 or older, as indicated by the orange bar at the bottom, account for 57% of total disease cases. In addition, in age 8 or older group, about 3 out of 10 confirmed cases are death cases. Even with differences in the number of confirmed cases, diagnosis, test, and treatment of cases, the pattern of an exponential increase in death with age is clear across countries. However, higher COVID-19 related risk to older persons are not limited to health-related risk. I captured the sentence from the UN Secretary General in his statement on the 30th anniversary of the International Day of Older Persons in 2020. He emphasized that the COVID-19 pandemic has wrought on older persons around the world, not only on their health, but on their rights and well-being. Therefore, I would like to describe some of the COVID-19 related risks, particularly associated with older adults' rights and dignity, so that we can find ways to prepare for the post-pandemic era. UN released the policy brief on the impact of COVID-19 on older persons, and they mentioned 3 broad areas of older persons' rights that are highly affected by the pandemic. The first area is life and death, that is closely related to health of older persons, as I presented earlier. The second area is vulnerability and neglect, to emphasize the higher risk among certain groups of older persons, including long-term care residents. And the final area is social and economic well-being of older persons. We'll look into these 3 areas more closely. The higher infection and mortality rates are partly due to pre-existing health conditions of older adults. According to a national survey, 73% of older Koreans reported having 2 or more chronic conditions. The pandemic may also affect the healthcare utilization of older adults. For example, 70% of older Koreans reported that they are reluctant to visit hospitals or clinics due to the fear of COVID-19. In Korea, however, decrease in healthcare use during the pandemic are not much evident among older persons, but particularly evident among children and adolescents. The orange line in the graph shows how much the healthcare visit days are decreased during the pandemic, and age 0 to 9 group shows the greatest decrease, while the decrease was not so much in middle and older aged persons. This healthcare use pattern may suggest that older persons have greater needs of using healthcare services, partly because of their pre-existing health conditions, despite of their fear of COVID-19. However, the healthcare service use pattern may be subject to each country's healthcare system and the total COVID-19 cases. In the United States, for example, with much more COVID-19 cases than Korea and no universal health insurance for those under age 65, 70% of older Americans aged 50 or older reported delaying or not getting the needed medical or dental care since March 2020. And the most prevalent reason of not getting or delaying health care was that their appointments were canceled or rescheduled by service providers. One of the vulnerable groups of older persons are those who live in long-term care facilities. They are already susceptible to the infection due to their disabilities, underlying medical conditions. Also, they live in a confined space and have inevitable contact with staff and other residents. In fact, clusters of infection occasionally occurred in the facilities. In Korea, for example, out of 819 death cases, 35% are related to running nursing hospitals and nursing homes. In addition to their higher COVID-19 mortality risk, the rights and dignity of the residents may be affected by the restricted family and friend visit and the lower quality of services. Also, in a national survey with long-term care facility administrators in Korea, 33% identified diminished rights of residents as the main challenge during the pandemic. Rising mental health problems during the pandemic is well known. People of all age groups experience increased stress, social and emotional isolation, and depressive symptoms. This phenomenon is also represented in the increased use of psychiatry services, while the most of other departments experienced decreases in healthcare use during the pandemic. Compared to other age groups, older adults could be more vulnerable in terms of their mental and social well-being. As shown in the left side graph, decreases in out-of-home activities are most evident in older adults aged 60 or older. The lines of the left side graph with light brown color indicate the mobility levels of age group 70 or older, and the line shows that those age groups show the lowest level of out-of-home mobility. Also, older Koreans showed relatively poor mental health even before the pandemic. For example, Korea has the highest suicide rate of adults aged 70 or older among OECD countries. We also may need to pay more attention to older adults who live alone. About 25% of older Koreans aged 65 or older are known to live alone. They are likely to receive less emotional support from families, have limited social network, and show more depressive symptoms before and during the pandemic. Economic well-being is another area to be highly affected by the pandemic. Older adults, along with other age groups, experienced increased unemployment and decreased employment rates during the pandemic. Economic hardship in later life has been a social problem even before the pandemic. Economic hardship was the most prevalent reason of suicidal ideas of older Koreans aged 65 or older. Later life poverty is particularly significant in Korea, as almost half of older persons live under the 50% of median income, while the rate is low as 80% in Germany and Sweden, for example. Finally, the presence of ageism and age discrimination have become more evident by the pandemic. We have observed that age has been discriminatory used in medical care decisions and public health policies. For example, indefinite isolation of long-term care residents has been widely accepted. Also, intergenerational division and devaluation of older persons are widely spread and evident in public and social media. Negative stereotype against older workers and age discrimination in workplace are also common. According to the survey conducted past year, more than half of younger people perceive that they have fewer job opportunities and have greater work burden due to older workers. Given these pandemic experiences, I would like to suggest some strategies to promote the rise of older persons in the post-pandemic era. First, we need to tackle ageism in healthcare system and other areas. We need to acknowledge that older population is not homogeneous, and chronological age is not the only criterion for healthcare decision-making process. We also need to develop public health protocols to protect the public and the dignity and rights of older adults, especially long-term care residents, in cases of future emergency situations. We also need to promote intergenerational solidarity with public education and policies. Second, we need to improve long-term care services and policies to better serve the residents and their caregivers. Specifically, we need to develop monitoring system for long-term care residents and services for their health and well-being. And we also develop monitoring system for staffing, operation, and medical and social research of long-term care facilities. We also need to address the pre-existing systematic problems in the long-term care system, such as inadequate staffing and inadequate monitoring and surveillance efforts at national and regional levels. Third, we need to pay attention to at-risk older persons, such as those living alone or in isolation. To ensure their well-being and health, we need to provide various social services. Technology use in the field of social and elder care services could be a promising solution. AI, smart home, and robots have been used during the pandemic, so the older persons have been able to get social and emotional care and automated emergency checkup without personal contact. Internationally and nationally, we may need to be prepared to this new trend and make sure the rights of older persons are protected by the use and non-use of the technologies. Another group who need attention is family caregivers for older adults. During the pandemic, care responsibilities of family caregivers have been raised unexpectedly without full preparation. In the future, we need to develop policies to protect their employment rights and well-being. We also need to support social inclusion and mental health of older persons by increasing their access to digital technologies to prevent their double exclusion from social context and digital access. In the meantime, governments and service providers should communicate through various outlets beyond digital media. Also, we need to provide emotional support for older persons who are isolated at risk of mental health problems. And we need to promote the inclusion of older persons in the community by encouraging connections and solidarity among community members with older residents. Finally, we should ensure the economic well-being in later life. To do so, age discrimination in workplace should be addressed, and lifelong education and work opportunities are needed. Also, we need to strengthen the social security system and other policies to ensure the various sources of income after retirement in later life. Thank you for your attention.
예, 감사합니다.
Thank you very much.
노인이 기저질환을
Yes, because the older persons have a lot of pre-existing conditions, so often we focus on death. But then it's not only that, it's not only the physical health, but then we also have to think about their social and mental well-being as well as the economic well-being. So thank you very much for the observations. She also made a lot of policy recommendations on how to address them. And I do believe that they would also be related to the experience from Denmark and Germany, and I would say that perhaps they are a bit more advanced in such thinking. So we will move on to the next presentation.
하고 계시는
We have Hana BECKER, First Secretary of Political Affairs from the Embassy of the Federal Republic of Germany, to share the German examples. Please turn on your microphone.
Sorry, okay. 안녕하세요. Good morning, good evening. First of all, I want to thank the organizers for this very timely event, as we already heard in the plenary, which is a very important topic. And also from a German perspective, that is why I'm very honored to be here today to give a brief overview of what Germany has been and is been doing in regard to promotion of human rights of elderly people. And maybe there might be also hints for how to overcome COVID and post-COVID. So if I start with some graphs regarding Germany, it's obvious that Germany is an aging nation too. Figures from 2019 show that 40 to 59 years old people made the largest group, while the second largest group was 65 years and older. On the right picture, we can see in European comparison that Germany looks pitch black, meaning that the population aged 65 and above in percent of the total population in Germany was reported at above 22%. And it has gone up from 2019, where the number was reported at 21.6%. So we can't turn our backs on the fact that society is aging, mainly as a result of the low birth rate and the fact that people are living longer. And those people who are living longer, they wish to live an independent life, even in old age, and that is why the German government is looking at means how to promote and protect quality in life, quality of the life of elderly people. So providing them with the support they need is one of the key objectives of Germany's policymaking for senior citizens. And there are two priority goals. The first is to support older people in need of care, help, or other forms of assistance. And the second is to use the potential of older persons to foster cohesion between the generations and promote a society based on sharing and solidarity. Germany is pursuing these goals not only on a national level. International cooperation is becoming increasingly important in view of the growing percentage of older people worldwide. Therefore, Germany actively advocates for older persons in an international context, like, as we already heard, in the United Nations, the European Union, the Council of Europe, or in direct exchange with partner countries. So what is Germany or the federal government doing on the national level? One focus is on the promotion of integrational equity and peaceful coexistence of all generations, because we believe that only this equity and coexistence in solidarity and harmony will bring about sustainable success, as well as create and preserve an attractive living environment for all age groups, in all phases and in every condition of life. There are different approaches, also piloted or tested and developed, on how municipalities in Germany can design demography. For example, through the project Municipality Workshop on Demography, launched in 2016, Selected municipalities have been supported and assisted by external counseling teams in designing demographic change over a period of 5 years. The findings will be gathered and evaluated and prepared also as to fed into the demographic strategy, so the local authorities, federal, states, and government departments can use these experiences as reference points. Operated under the federal program Multi-Generational Center, some 550 multi-generational centers provide place for people of all ages to meet and engage in a wide range of activities across generations. And under living and old age, programs and projects' core aim is supporting an independent and self-determined life for as long as possible. The various projects focus on shared housing, age-appropriate home conversions, ambient assisted homes, local support and advisory services, as well as neighborhood help schemes. A very important role in the German welfare system is played by the non-statutory welfare organizations and senior citizens organizations, which are indispensable in promoting social cohesion in Germany. Therefore, the Federal Ministry for Family Affairs, Senior Citizens, Women and Youth, which is a very long name, and I will just shorten it to the Federal Ministry of Family Affairs during the presentation. This Federal Ministry of Family Affairs provides funding to these organizations that makes it possible for them to maintain necessary structure at the national level, and so as to conduct own projects and programs. And I didn't want to miss the national dementia strategy as well, because this is getting a bigger and bigger challenge faced by society today. In Germany, some 1.6 million people suffer from the illness, and a comprehensive approach to dealing with dementia is driven by the Federal Ministry of Family Affairs, together with the Federal Ministry of Health, as to improve the living situation of people with dementia and for their relatives, and build sustainable structures for the future to secure the inclusion in society as a whole. So quality of life of people in need or in need of care or assistance heavily depends on people who care about them, so about professional care or house care. In this regard, another focus is reconciliation of family, care and work. A range of legislative acts have been enacted so far and developed, such as the Caregiver Leave Act and the Family Caregiver Leave Act, that makes it easier for employees to take care of close relatives in need of long-term care. The other focus is on professional care, where the Federal Ministry for Family Affairs is working with the Federal Ministry of Health to improve the quality and the attractiveness of vocational training and education for nursing care professionals. Last year, the Care Professions Reform Act took effect in January 22, and it has changed the training for nurses as to make vocational training more effective and attractive. To further improve the vocational training, education, and nursing care, as well as the working condition and payment of the care professions, the campaign Concerted Action for Nursing was launched by the before-mentioned Ministries of Health and Family Affairs. So, the last point is actually a point I want to elaborate on, because this is a point we already heard about: lifelong learning, digital education, and how important it is that elderly people will be provided access and the skills to join the social or the digital society, actually. And when we look at this graph in Germany, in 2017, we can see that the proportion of people with access to the internet by age group and education changes toward the older age. So the numbers decrease with age and the lowest in the education level, so who have access to internet. And already today we have new information and communication technologies, which means there are new development opportunities for elderly people or older persons. We need, on the one hand, high quality, accessible and easy to use form of digital communication, but at the same time, we need new media skills and literacy in the digital technology to use them, which is a prerequisite for social participation these days. And this can heavily contribute to reducing social isolation of older persons. What is important is that the systems should be safe and secure, both in terms of their proper functioning and under privacy aspects. The responsibilities for ensuring this safety and security therefore must be specified. And here the involvement of older persons as co-developers of ICT and further training of us in the field is of fundamental importance from our view. Also, in firms and companies which face a progressive skills shortage, a flexibilization of working arrangements before and after the statutory retirement age, combined with courses that prepare post-retirement, could also promote the lifelong learning and upskilling of older persons. So, in a nutshell, speaking about digital education in old age and what Germany finds important is key improvement measures are to put sufficient structures in place, especially at the local level, meaning at the ground where we really can reach the older persons, and ensuring that flexible structures are established and affording older persons active opportunities to participation and design. I would like to stress that in the context of demographic change and population aging, the right to education is not limited to children or to young adults, and it does not end with mid-adulthood or retirement. In Germany, since the 1980s, study programs for senior citizens have been increasingly established, but digitization or digitalization is adding a new layer on that and highlighting the importance of lifelong learning. So, elaborating on what Germany has been doing in the field of digitalization education for older persons, first, want to mention that a service center was set up called Digitalization and Education for Older Persons, which functions as a nationwide support structure. It serves as an information hub and was actually set up upon recommendation of a roundtable called Active Aging that had been established with broad societal participation. So civil society is actively engaging in these debates as what can be done to include or to increase the social cohesion and to include older persons in digital society. Beyond that, an advisory group on digitalization and education for older people was also set up in 2018. Not only does this council provide recommendations and suggestions for technical work of the federal government, but first and foremost, it pools the technical expertise held by policymakers, practitioners, and academia, and advances subject areas of education for older persons and digitalization for older persons. An expert commission for the preparation of the federal government's 8H report has also examined the contribution that digitization and technology can make to a good life in old age and what benefits and added value they have for older people. The commission dealt with the societal, social, and ethical issues that the increasing mechanization of everyday life for older people bring with us. Finally, the experts have compiled 12 recommendations which address the federal government, the federal states, lender, and the municipalities together with other stakeholders and also older people themselves. The 8th government report on older persons was published last year in August. One of many projects I want to highlight here, it was difficult to choose one, I think, but Digital Angel is definitely a project I want to briefly introduce. The Digital Angel project complements the Service Center Digitalization and Education of Older People Supporting Network. It is a mobile team of advisors that offer personal contact and digital support knowledge to older people. So since November 2019, a bus of mobile advisors toured through Germany to meet people locally and teach them how to use applications or how to do online shopping and very minor questions like that. They had to pause due to the corona pandemic, but they started the tour again in September 2020. So, as earlier mentioned, Germany is not only promoting education, lifelong learning, digitization on national level, but also on the EU level. Germany used its presidency of the Council of the EU till December last year to raise awareness of the topic and to initiate a discussion of lifelong learning and digitalization also at European level. For example, Germany organized a joint online conference together with the Age Platform Europe and the German Civil Society Organization for Senior Citizens, entitled Strengthening Older People's Rights in Times of Digitization, Lessons Learned from COVID-19. The online conference last year, end of September, had more than 1,500 participants from over 60 states, including Korea, and worldwide participated in the event. Germany also drafted council conclusions on this topic. In October, this politically binding instrument was approved by all 27 member states of the EU. This was a major success, as the Council conclusions are the first ones in 10 years that deal with the topic of aging and older persons and their rights. In the Council conclusions, the EU and its member states commit themselves to promoting lifelong learning opportunities. As was already briefly touched upon, there are also on the United Nations level different groups that deal with human rights and protection of elderly people. I don't really want to elaborate on this one. Just want to say that though the open-ended working group session in New York last year had to be cancelled due to COVID-19, Germany, of course, continued the discussion internally and continued its discussion internally and how we will further act in the open-ended working group in New York. So coming to the end, some findings or some thoughts I find most important in this context. First of all, I want to start with a finding also from the aforementioned online conference, because I think we can't say this enough, that human rights have no expiry date and are not tied to a person's age. Senior citizens today, if I may say so, are generally healthier and more vibrant and energetic than earlier generations. They also want to continue their involvement in the working world, as can be seen in Germany, where the percentage of people who stay in the working world after retirement age is increasing every year. However, prevailing images of old age are still based on those of previous generations. These usually relate to illness, decay, rather than available skills, experience, and potential. We've already heard in the plenary that COVID-19 has exacerbated the general perception of the population over 60, or what is considered older people. Older people are being portrayed as vulnerable and weak, needing protection. But there are also surveys in Germany where this perception is not differentiated. Because people who are actually surveyed, if they consider themselves as needing protection or being weak, they actually said that's not always the case. So people are looking at the older person in terms of age, but maybe not really in terms of how their health status is, which is a more important indicator when talking about who needs protection and in what way. So this point was already raised. It was a question also in the plenary, saying exit strategy from the pandemic must ensure that all people can participate in cultural, economic, and social life, and no group is advantaged or disadvantaged. I think this will open a huge discussion. We already heard some arguments. Maybe we can also continue on that later on. But I think this is a very important point. And another point I want to point out is that lifelong learning is the major guarantor of active and healthy aging and social participation. Especially literacy and skills on digital technologies is a prerequisite for social participation or in a society or digital society, which we are increasingly becoming. Therefore, it is essential to secure continued development of people's abilities, even in their post-employment age or phase. The question, what can technology do, actually is also merits discussion, I guess, but what can be said is that technology must benefit people or should benefit people, while we shouldn't be dependent on technology because technology can never replace face-to-face human contact. So in discussing about the role of technology could play in the professional care system, we should keep in mind that technology can't replace humans. Last but not least, international cooperation is becoming increasingly important. I've already said that, and the view of growing perception, the percentage of older persons worldwide. So I just want to make the point, lastly, that Germany therefore advocates for older persons in an international context. Thank you for your attention.
예, 감사합니다. 독일의
Thank you very much. That was a presentation on the overview of the German older persons related policies in the context of COVID-19. What are some of the specific measures that we should be focusing? I think we were able to learn a lot from your presentation. As a person studying gerontology, not only the central and local governments, the private sector as well as families have very important roles to play. I think that was a very big implication for us, especially in the digitized society. What are the tasks and challenges that are given to our elderly population? What is the task as a society we should focus on? I think it was a good starting point for discussion. Thank you very much, Hana BECKER, for your presentation.
경험을 좀 들어.
And let us now listen to the experience of Denmark. We have the health counselor, Nena BOEL. So here, please go ahead.
Thank you very much. First of all, I'd like to thank the organizers for providing this opportunity on this very important topic. I work as a health counselor at the Embassy of Denmark in Korea on the government-to-government collaboration that our countries have in the health sector. And I've been asked to give the Danish perspective. So I will just start with briefly setting the context. Denmark is a small country in Northern Europe, just north of Germany, which you've just heard about. We have approximately 5.8 million people. So we are half the size of Korea and about 1/10 the population of Korea. And 20%, about 20% of our population is above 65 years of age. And we have, like Korea, an aging population with a fertility rate of 1.8 and life expectancy of 81.4 years. So we see in Denmark, like in Korea, that people are living longer. We see more chronic diseases, and we see that this demographic change causes certain challenges in relation to COVID-19. So just to speak briefly about the Danish healthcare system. In Denmark, the handling of COVID-19 has been a combined effort of the government and of the healthcare system. The Danish healthcare system is funded almost exclusively by taxes, so healthcare and rehabilitation is free at the point of delivery. This also means that no patients have been brought into financial trouble due to COVID-19. The Ministry of Health has been responsible for establishing the overall framework for the provision of health for the elderly. Hospitals are run by regional entities and have been responsible for hospital care for the elderly, including emergency care and for the health services provided by the general practitioners and specialists. The local municipalities, which we have 98 of, have provided the home care services for our senior citizens, and they have also been in charge of disease prevention and health promotion. In our system, the general practitioners play a very central role, so that's why I will just touch briefly about on this setting. Our general practitioners are the first point of contact for the patients in the Danish healthcare system and handle many treatments in their clinics. They can make referrals to specialized services, and as such they function as the gatekeepers for more specialized treatment. In relation to the elderly, who often have high comorbidity and fall ill more frequently, this is particularly important as they have many different contacts with different parts of the healthcare sector. So having this one person, the general practitioner who has the overview of the patient's entire medical history, current treatments, is quite important for the follow-up. GPs are also responsible for follow-ups after the patients have been admitted to hospital to make sure that everything is as it should be and checking that prescribed medications are working. So from this perspective, from the Danish perspective, the GP system helps ensure continuity of care, which is an important aspect of maintaining dignity of care for the elderly citizens. And just to mention that during COVID-19, we've had the direct pathway to COVID-19 testing. So, in relation to the government's responses to COVID-19, like in many other countries, Denmark have had 2 waves of COVID-19 so far. We had in February last year the first lockdown in our country, meaning that all workers but essential staff were sent home. Cultural institutions and entertainment venues were closed. Cafes and restaurants were closed and only for takeaway. And stores, except pharmacies and groceries, were also closed. So people were advised to stay home and not see any families or friends. From mid-April, Denmark had a gradually loosening of restrictions with finally very few restrictions over the summer. Over the summer, we've increased our testing capacity rapidly, even through the government has intensified testing capacities and restrictions during the autumn. We did have the second wave, which resulted in the most of our hospitalizations peaking around Christmas, which is a rather big holiday in Denmark. In Denmark, so as I mentioned, we are in the middle of this second lockdown of the country. And in January, restrictions were further expanded due to the fear of the mutated viruses. The Danish authorities have raised the risk level from 4 to 5, which is in our country the highest level. And right now we're seeing that only the youngest students are permitted to attend primary school. Most likely there will be a new announcement later today on how we will start opening up society again. So just to give you a brief overview of the COVID-19 situation we've had as till now, we've done more than 15.8 million COVID-19 tests since March. So many of our citizens have been tested several times. There have been a total of 206,000 COVID-19 cases since March. We have a case fatality of 1.1%. And 5.2% of the Danish population have begun their COVID-19 vaccination process. We started this the 27th of December, and we expect to have offered vaccinations to the full population by this summer. And vaccinations in Denmark are voluntary and free of charge. Sorry. Globally, the virus continues to take a particularly hard toll on older people. And if we look at the COVID-19 cases according to age group in Denmark, we see that despite accounting for approximately 26% of the Danish population, the elderly from 60 and up make only up 16.5% of all COVID-19 cases. So if we focus on the low case rate amongst the elderly citizens, the lockdown of society and the strategy of isolation, especially amongst the elderly, have, from that perspective, can be seen as quite successful. So remaining is then the question of human rights and prioritizing of health above personal liberty. So regarding older persons in the EU, the pandemic has particularly affected the rights to life and the right to health, and issues around access to treatment and testing, The situation in institutional settings, access to services, and the impact of isolation emerged across EU during COVID-19. This has affected older persons' right to lead a life in dignity and independence alongside many other fundamental rights. The European Union's Agency for Fundamental Rights have mapped 5 specific challenges facing older persons during the pandemic in the EU, and those are the ones that you see on this slide. And I will speak about these in relation to the Danish case. So, for the first one, systematic testing for COVID-19. The high rate of deaths in nursing homes have been a trend throughout all of Europe. So there's been a call on establishing regular testing for COVID-19 and to prioritize staff and residents at care homes, as the WHO have pointed out that systematic testing is essential to prevent and contain outbreaks. Denmark has primarily relied on regional coordination regarding this matter, and that's because of the structure of the Danish healthcare system as described previously. Until June, Denmark only tested staff and residents in care homes when a case was detected. However, the fact that almost every third COVID-19 death occurred in a nursing home in Denmark in the spring called for more systematic testing. In this regard, it should be stressed that the average age of people moving into nursing homes in Denmark is 84 years. And approximately 3.6% of Danes above the age of 65 live in nursing homes. So since the end of June, regular testing of staff at nursing homes have been done even when they appear symptom-free. Residents moving into nursing homes or residents who've been admitted to hospital and are returning to the nursing homes should also be tested and wait 48 hours for the result before they move back to the nursing home. So for the second one, discrimination concerns in hospital triage. The pandemic has put tremendous pressure on national health care systems, especially intensive care units. Medical staff have faced difficult choices about prioritizing treatment in the light of scarce resources and putting the right to equal access to health care at risk. International and national actors have called on health authorities to ensure that all patients are treated equally, that decisions about life-saving therapies and access to care are based on medical needs, and that they are objectively justified and allocated without discrimination. So evidence collected by the European Union Agency for Fundamental Rights indicates that the majority of EU countries did not explicitly stipulate age as a decisive criteria during patient triage. Most European countries issued national guidelines stressing the importance of equal access to healthcare. However, a few exceptions in EU countries have been reported where guidance to support doctors determine which patients to prioritize for life-saving treatments and suggested a patient's age as a key criteria. The third one is regarding specific restriction measures that are affecting older people. So, from the onset of the pandemic, many European countries have put in place specific restrictive measures or, in some instances, recommendations which have targeted older people. There have been no restrictions specifically targeting older people in Denmark. So older people in Denmark must follow the general rules addressed to the whole population. However, all the European countries introduced initiatives to meet older people's basic needs during the lockdown period and to mitigate the impact of restrictions imposed on them. In Denmark, senior citizens can always contact the municipality if they need help. And we've also seen that non-governmental initiatives have helped the elderly during the COVID-19 pandemic. So that's sort of support networks for the senior citizens. The fourth one, which the agency mapped out, is social isolation. During the critical periods of the pandemic, the whole population in Denmark were advised to stay home and not see anyone, especially stressing this for the elderly, considered at greater risk of dying with COVID-19 due to their age. Physical distancing requirements has posed particular challenges to senior citizens, many of them who live alone and may lack the equipment or knowledge to take advantage of digital tools to maintain social contact. In Denmark, most elderly people live in their own home, which meant that they were facing a risk of loneliness, but that they were not subject to specific restrictions, so they could still meet up with friends and family, taking the risk of COVID-19. On the other hand, the government decided to make a complete lockdown of nursing homes in Denmark, meaning that the elderly people in nursing homes were banned from receiving visits from relatives. So from a human rights perspective, there's been some critique of the Danish government's restrictions, bans on visits, as some older persons living in nursing homes have been deprived of their liberty due to COVID-19 safety measures for their health. The restrictions interfere with basic rights, including the individual's right to freedom to decide over their own home and family restrictions, which has been highlighted by Danish organizations that are speaking to the rights of the senior citizens. While many countries in Europe have made restrictions on nursing homes, most countries have withdrawn the restrictions a lot faster than Denmark or made exceptions. So we know that the elderly have an increased risk of dying due to COVID-19, but as some of the elderly do not have many years left and we don't know how long COVID-19 will last, their quality of life should also be considered in a human rights perspective. And that's why in Denmark we've had this discussion and this very important question, whether we are adding years to life or if we're adding life to years. The last one is access to wider healthcare services. So EU countries have faced the challenge of ensuring continued access to healthcare services and medical treatment while still treating patients with COVID-19 and containing the outbreak. And one important measure that we've seen in Denmark to address this has been telemedicine and phone consultations with the general practitioners. This has been a way to access healthcare services while still limiting the risks of COVID-19 to our vulnerable population. The fact that regular care and treatment at hospitals in general has been postponed in Denmark so far as possible has had a greater impact on the elderly who have had to go to health checks at hospitals more frequently during normal times. Many European countries prioritize treating COVID-19 patients over other areas of healthcare, with many countries suspending non-urgent treatment or limiting physical access to doctors and healthcare services. Such restrictions hit older people harder, as they are more likely to have existing medical conditions requiring treatment. This raised questions concerning potential discrimination in access to healthcare. Furthermore, home care services have been significantly reduced, minimizing the health assistance and the daily social contact of the elderly living at home. In addition, organizations in many EU countries highlighted the impact of disrupted or curtailed services on the mental and physical well-being of people with dementia, which was also touched upon by my colleague. Reducing basic services for people with dementia impairs their ability to conduct their daily lives. In addition, older people with dementia have been at higher risk as well as they have had difficulties protecting themselves from COVID-19, forgetting to follow guidelines and might not even understand when they have symptoms of COVID-19. So we've seen different initiatives to support the elderly in during lockdown. As already mentioned, many EU countries have introduced initiatives to help the elderly with shopping and for food and medications, and have also given psychosocial support. As COVID-19 has been a challenge for mental health of many individuals, there's been many different initiatives in Denmark. We have no scientifically collected data on the experience in nursing homes. However, many places have reported that their elderly felt lonely and needed stimulation. So as a result, the Red Cross have been offering digital visits for people who reported being lonely, and other organizations have been offering phone services called Phone Friends, specifically targeted at elderly people. In European countries, we've also seen initiatives to improve older people's digital skills, which was mentioned by my colleague. So it would be easier for them to stay in touch with family and friends online. In Denmark, the Alzheimer's Association and the Danish Dementia Research Center has published material for relatives and professionals about COVID-19 and people with dementia. And regarding experience of lockdown amongst the elderly, we had one recent Danish study called Standing Together at a Distance, documenting changes in mental health indicators in Denmark during the COVID-19 pandemic. It's from the University of Copenhagen, and it showed that despite being at a significantly higher risk in relation to COVID-19, the elderly didn't worry significantly more than the young. On average, the elderly said that they felt less lonely than younger people. Elderly people living at home showed good coping and mental resilience using their network and the opportunities and technologies available to them. A low degree of financial insecurity amongst the elderly because of the Danish pension system is probably one of the factors in this, and we see more worries amongst the young due to the risk of losing their job and their main source of income. But with this, it should be noted that the experience of the lockdown in nursing homes has probably been quite different, as nursing homes were completely locked down. So this is unlike the elderly living at home who were advised to self-isolate but didn't strictly have to do so. But however, we don't have any scientifically collected data on the nursing homes. Then on the right to health and on the vaccinations in Denmark, so to secure the right to health for all, the vaccination program prioritizes the elderly and the vulnerable to minimize severe illness and death. And in prioritizing target groups, the Danish Health Authority has primarily focused on the following main objectives in the vaccination program. So the first is minimizing death and severe illness due to COVID-19, minimizing the spread of infection and epidemic control, and last one is ensuring key societal functions. And in these prioritizations, it is clear that the senior citizens and the nursing homes have been prioritized. So looking ahead, many initiatives to support older people have involved cooperation between local authorities, civil society organizations and volunteers, and the private sector. As societies reopen, it's more important than ever to keep a focus on the elderly, for whom the passage to the new normal will likely be slower and more difficult. The pandemic has served to underline the contribution older people make to our communities, anchoring responses to the pandemic in the recognition that equal treatment is a right regardless of age will ensure that older people can live full lives in dignity and respect. So Denmark will continue to focus on including the elderly in decision making in the prioritization of our vaccinations rollout, in initiatives to support older people during a lockdown period, and also in relation to online consultation, telemedicine as a way to increase the access to healthcare services. And in relation to nursing home, upscaling the testing capacity. And lastly, to provide digital support for the elderly. Thank you very much for your attention.
예, 감사합니다.
Thank you very much. So the experience of Denmark, I would say that it also gives us a lot of implications, important ones, especially despite the lockdown. Now, the fact that they were able to maintain their mental resilience, perhaps it is due to the pension system. So then related to the presentation by Dr. NAMKUNG, she also mentioned that the economic aspect was also very important. So I believe that that is also a very important point. So that is one thing that we also have to think very deeply about. And I do realize that we have gone slightly over time. So then now to the discussants, I would like to ask you to keep to your time limit of 5 minutes so that we will be able to handle the questions that have been received so far. So then I would like to first invite the first discussant.
From NHRCK, we have Deputy Director Lee Dongwoo to deliver his comments. Hello. As was introduced, I'm Lee Dongwoo. I'm currently working at the Division for Social Human Rights, responsible for the human rights of older persons at the National Human Rights Commission of Korea. First of all, I'm very honored to be part of this very important discussion on human rights of older persons. And Dr. Andrew Buns and Dr. Tiri Madsen gave us their presentations and also explained about the background paper for the discussions. Many of the question marks that I had, for example, was the definition of older persons, what would be the age threshold for defining an older person, how do we perceive them as rights holder, what do we need to do to make sure that they're guaranteed the rights, what are the international efforts, regional as well as sub-regional efforts that are underway. And these questions were very much answered in their presentation, so I thank the two presenters very much. It was a very big learning opportunity for me. The two rapporteurs' presentations, their presentations were very insightful. I think it really requires further study, further exploration, and it will be used as a frame of reference for our international endeavors and discussions going forward. So I've just heard from three presenters. Dr. Namgung Eun-Ha talked about the Korean situation, and also First Secretary Hana BECKER on German situation, and also Counsellor Nena, MONRAD, BOEL on the Danish example. First, from the first presentation by Namgung Eun-Ha, we were able to understand the impact of COVID-19 on older persons, especially in terms of the fatality. Those people who are confirmed and who die as a result of infection, the highest rate is seen among the older populations, especially in the 70s and 80s. So we were able to confirm that fact once again. So in relation to COVID-19, the older persons are actually at the borderline of life and death, and due to social distancing measures and containment, lockdown measures, they're isolated and they're feeling lonely in society. And First Secretary Hana BECKER presented a very meaningful content that there is no expiry to human rights, that age really doesn't matter when it comes to human rights. And again, the exit strategy from a pandemic must ensure participation by everyone. And most of all, the older persons must be engaged in the process. And literacy in digital society would be very much required for older persons because it becomes a prerequisite for their social participation. And also, she shared various meaningful programs, for example, Digital Center, Digital Angel Project, and other programs. They're very useful indeed. Thank you very much. And Counsellor Nena MONRAD BOEL from Denmark shared with us the Danish case study. Most of all, as we've heard from these 3 different cases from Korea, Germany, and Denmark, the commonality is that COVID-19 is posing a big threat to older persons, and the process of overcoming COVID-19, the older persons must be ensured of their right to participation in decision-making process. And also in order to ensure that digital literacy and also lifelong learning must be provided. So the right to education, even in the international human rights literature, it is a basic fundamental right. And it applies to everyone, including older persons. So lifelong learning, yes, it is one of the basic rights that should be ensured of everyone, including older persons. So let me now share with you my opinions on the topic. Especially in terms of participation by older persons in digital literacy and training, yes, they're very much emphasized. And for this meeting, we have older persons supporters who have joined us for this program. So they're the rights holders themselves, and they are now they have to be able to access digital technology, and they're actually taking part in this event together. So this is very meaningful that we're joined by these supporters for the human rights of older persons, and this is really relevant for the theme of this conference as well. I just wanted to share that with you. So from the point of human rights, if you look at the COVID-19 crisis and the impact, we need to understand the type of impact that it has had on the most vulnerable persons and what are the long-term measures that we can seek. And we have to take a human rights-based approach in doing that. The COVID-19 crisis is increasing the vulnerabilities of the weakest members of society. They not only include older persons, but children, refugees, migrants, the poor, people with disabilities, and prisoners, as well as minority groups. Another point that I want to stress is that in too many societies, there is a stereotypical thinking about gender, and also deeply rooted roles of gender. There are social distancing measures in place, people that have to stay home to take care of their children or to take care of the elder members of the society. That burden is disproportionately imposed on women of the family. So the COVID-19 infection is aggravating gender inequalities and disparities. In relation to responding to COVID-19, everyone's inherent dignity must be respected and protected. And in these difficult situations, the most vulnerable and marginalized people's economic, social, and cultural rights actually become the essential elements that can protect and safeguard themselves. And this is what we need to do in addressing the human rights situations of older persons, especially during the COVID-19 pandemic. The vulnerabilities of the older persons are aggravating it even further. And especially the older persons are now pushed to the brink of death during the pandemic. So what's really important here is to make sure the older persons are able to lead their lives with dignity. And also, in the process of their death, their dignity should not be lost. And as such, for such dignified life and death of older persons, the rights of older persons must be contained in a legally binding international document, the International Convention on the Rights of Older Persons. I believe that such a treaty or convention must be established in the earliest manner possible. And also in that process, the ASEM, Global Aging Center, as well as other international organizations must come together and promote their solidarity. Last but not least, I want to point out that we have to change our awareness about the older persons, that the people have different perceptions about older persons in society. And together with that, older persons themselves have to change their perceptions about themselves. That is why I talked about the need for re-examination, that we need to revisit how we view older persons in society. With that, I will conclude my comments. Thank you very much.
Pratade innan. Säger hon ingenting? Jag stängde av ljudet.
마이크 괜찮은가요? 네, 예.
Okay, so my microphone is working now.
인터내셔널 아시아
Now, it is Eduardo KLIEN from the HelpAge International Asia Pacific office. I understand that you're in Chiang Mai, Thailand. Are you here? So yes, please go ahead.
Thank you, Ms. Kyung-Hee. I want to relate to the initial presentation, especially from Professor Titi Mattsson, and I'm going to talk also about the post-pandemic period, not the immediate post-pandemic, but looking at the mid-term, the long-term. I know that the pandemic period has highlighted enormously the inequalities or the systemic failure of the care systems. That's very clear, I think, to all of us. But I believe we need to focus a bit more on the change in demographic configuration and how that demands rethinking aging. And I think Professor Mattsson highlighted that. No? In middle income and low income countries in Asia, people are now living 15, 20 years longer than they did 20 or 25 years ago. So this extension in longevity is also bringing the need to rethink how old age is seen. However, the laws, the legal issues, the retirement laws, for example, in China or in Vietnam, they remain as they were 20, 25 years ago. The official narratives and the social narratives, which is most worrying, remain similar in the sense that older people is a very short stage of life and in where older people are largely vulnerable. But life is showing us that that's very different. For example, in the pandemic, during the pandemic, the role of older people in their communities has been crucial, has been important in supporting other, not only other older people, but other vulnerable sectors of the population. So older people as a resource is something that has to be considered. Now, the point I also want to make is ageism. This was highlighted in the initial presentations. How is ageism expressed? It's not only the blatant discrimination, but we may also be having some implicit ageism when we consider all older people as vulnerable. And I think that is wrong. That is thinking of older people as subjects to support, not as active agents of their own future. Although in many declarations we say it, but then when we go to the ways, for example, the ways the international legislation is promoted, we highlight mainly the vulnerabilities of older people, or the needs for support of older people. But why don't we see the other side of the coin, older people as a resource to society? And this is maybe highlighted in the Madrid International Plan of Action that recognizes the potential of older people. In other declarations in ASEAN, for example, they frequently talk about older people as a contributor to their communities, no? But if we have 600 million people now, today, in considered older people in Asia, and we will have 1.3 billion people, 1.3 billion in 2050, so how can we possibly consider that large number, 1 in 4 as vulnerable. I mean, no society would be able to include that. We need to have a much broader view of what is aging, and the WHO has expressed it in a very beautiful manner. WHO has expressed how the decline in life and how the systems, the decline in functionality and how the systems can be built in order to maintain that decline in a less steep way. So well, I just want to mention two examples, for example. One is that in Asia, for a large proportion of communities have older people caring for older people, so providing home care. There are extensive home care programs where the older people as a resource are supporting the lesser number of older people who are vulnerable. Recently, we had a discussion a couple of weeks ago on climate change and older people. And for example, when we see the intersectionality between this mega process, which will be like the pandemic multiplied by 10, which is climate change, when we talk about it and the intersectionality with older people, we see older people only as vulnerable. But that is not necessarily the case. Older people, yes, of course, older people are disproportionately affected. But we also have, apologies for the dog, I don't know how to make him shut up. But we also have the potential of older people as a resource. Older people in community levels, older people having a large proportion of the disposable income that can be directed towards climate-friendly investments or the providence of pension funds. And to finalize, I want to highlight the very interesting presentation of the presenter from Germany on how the intergenerational action is promoted at local levels, at national levels, at international levels. And I believe that is the way to go when we have this huge demographic transition. Thank you very much.
예, 감사합니다.
Thank you very much for that.
Last commentator is from Age Platform Europe, Nena GEORGANTZI. Please, the floor is yours.
So the presentation that we heard today have really reiterated the fact that the pandemic has rendered more visible that our society often treats older people as second-class citizens, as expendable, even if this is not necessarily done intentionally. So whereas we would consider, for instance, discriminatory to impose confinement on the basis of race or to deny people necessary health treatment because of their gender, such practices, which were largely applied during this pandemic, are still considered not only acceptable, but even not against the law. So ageism does not only drive such practices, it also obscures our collective ability to perceive these measures as unjust and a violation of human rights. So what I think is that we see now is that the biggest inequality that older people suffer is the fact that their unequal suffering is not seen as a form of discrimination for the purposes of law, policy, but also public opinion in general. So prejudice on the basis of race, sex, gender, disability are all subject to explicit human rights obligations for states to take steps to eliminate them. But this is not the case for age discrimination and ageism and needs to be rectified, as others have reiterated. During the pandemic, only 3 EU member states consulted older people through their representative organizations. This was part of the study done by the Fundamental Rights Agency. And this is a clear demonstration of our failure to really facilitate and promote older people's potential and full participation in practice. Now, ageism, and others have said that already, is not new nor unique to the pandemic, but the pandemic does require us to make important decisions about our future. So the question is, how do we move on? Do we continue with the same status quo, treating older people disadvantages as less serious? Or do we fundamentally rethink how we age, the attention, recognition, and support we give each other when we're older? And I think, and as many others have said before me, that we need to do the latter. We need a different narrative, a different frame. So the EU and the member states of the EU have actually done this gradually. So they have moved their approach and recognized the opportunities of aging and the importance of intergenerational solidarity and of active and healthy aging. But the problem is that they have not done so unambiguously, nor in a consistent way. So in practice, we see discrepancy between the rhetoric and the practice. We see the competing paradigm of aging as a problem still prevailing. And this has been exemplified during the pandemic, where older people have been stigmatized as homogeneously vulnerable and in need of protection, or where we had suggestions to tax older people to pay for the so-called sacrifices for younger generations, and this creating a lot of intergenerational tension. But even recently, the Green Paper on Aging, which was launched by the EU, had still as its departure point the idea that an aging population is a problem for economies and for future generations. So the weight, it did refer to opportunity, but the weight really was put on the challenges and the problems. So this framing is problematic and it stands in stark context with the great achievement of the Council conclusions that were adopted during the German presidency that really called for a rights-based approach to aging. And I was really happy to see many of the panelists today really reiterate this idea for a consistent rights-based approach to aging. Now, a concrete example of the shortcoming of this framing that we have today that problematizes older people is that we tend to look at individual vulnerabilities instead of the vulnerabilities of the systems. So older people's right to receive support and live in the community is not guaranteed on an equal basis with others, but only as long as possible. This is actually the language that is used in many legal and policy frameworks in Europe today. So instead of that, we need to look at all the circumstances that no longer make it possible for an individual to live it at home. So be it the range or the quality of the services, the societal barriers that create limitations, because actually we can all contribute and prosper in an enabling environment when we have adequate support. So unless we really change one and for all the way we frame our responses to aging, the violations that we see today will continue. And human rights must be the narrative and the tools that drive new policies and laws that will get us through this recovery. So how do we do it? I want to suggest 3 ways. So first, we need to start with language. We need to avoid talking about older people as homogeneously vulnerable. Many people said it today, but we still do it. We need to recognize their diversity and all the different factors that actually may cause risk. We need to ban the term elderly. It is pejorative and reduces older people to a set of deficits and needs. And we need to stop talking about them, but instead talk about us. We are all aging, our parents are aging, our children are aging. And we need to talk about what is happening to older people, not as casual failures, but just as what it is, human rights breaches. Second, we need to recognize in practice older people's agency and involve them, to give them a voice, to give them the opportunity to contribute, to become part of the solution, to be workers, caregivers, volunteers, have different roles. They need to be regularly consulted in policy formulation, in its implementation, but also its review and assessment. And they need to be included in data and human rights impact assessments, because without this, we do not know the situation. We cannot render the inequalities visible and to target those that actually need our help most. And finally, as said by the UN Secretary General, we need stronger laws, both at national and international level. And the international human rights law that we have today, as mentioned in the background paper, is actually ill-equipped to address the violations that we have seen during the pandemic, to provide remedies, and to ensure that these do not happen again. It is not fit for purpose precisely because it reproduces the same biases that we as society have. So a UN convention will really provide us with this very much needed frame. It will moreover provide us with this moral, legal compass, a kind of yardstick that can help us see the gap between our aspirations, our rhetoric, and our practices, so that we will be able to challenge the practices that keep us from living fairly and freely as equals when we are older. Thank you.
예, 감사합니다. 저희가 줌을 통해
All right, thank you. So now we have also received a lot of questions and comments via Zoom, and I would like to deliver them later on. And as I had introduced earlier, we also have the activists at the HROP supporters, and we have received questions from too. So we would be listening to the question. So now, Ms. Kang Yeosil, are you there? Yes, if you could turn on your audio and video. Yes, hello, hello. Yes, please go ahead with your question. Well, thank you very much for the talk. I was listening very attentively, some with understanding, some without, but I would like to ask some questions. Now then, for COVID-19, well, in terms of the damages, then, to the older persons, and also, so it is riskier to the older persons, especially to those with pre-existing conditions. Now, knowing this, then it makes us more anxious about going to hospitals, and they tell us that the older persons should stay at home. But that's not easy, especially for those living alone. We just feel so isolated, so alone. Then that is why we also are receiving newsletters from the older person centers, and so we are getting news from them too. So we are getting some support, but still, without mobility, it is very difficult. So then in this COVID-19 situation, what are the measures or the initiatives that can ensure the social participation of the elderly? I wonder whether there are some such cases or initiative in other countries as well. All right, thank you. So I hope the speakers will prepare their responses to that.
Next is Chen Ak-do. I am Chen Ak-do from the Central Welfare Center. It is an honor to join this distinguished group of older persons experts around the world. And thank you very much for the invitation. I'm over the age of 80, and sitting here really gives me overwhelming emotions, mixed emotions, I should say. Now, COVID-19 has given us a lot of isolation, but those people that are working at the welfare center, our angels, are out there to safeguard the health and safety and well-being of older persons. At a welfare center, I'm getting, for example, vegetable kits, art kits, various kits that I can use at home, and I share these stories on the internet. I continue my communication with the outside world. And also the calligraphy lessons are provided to me on Zoom, so I can meet with the instructors on Zoom and I can continue on with my leisurely activity. So in overseas countries, this contact-less programs, do you have any programs for educating or training older persons using this online channels? Yes, I think all of you are very much appreciative of the programs that are provided to you, but you also want to make sure that you're a part of the society, and you also want to understand more whether there are any programs overseas for providing such training or education opportunities for them. We had some questions from other online participants. Some of the questions were related to the statistics from different countries, and I think those presenters who are looking at this could just put the answers in the chatting room. There were also comments, and before relaying these comments to the presenters, among the Danish practice, that the older person's infection and death rate is lower than other countries, and why was it possible in Denmark? So if I could ask Nena, MONRAD BOEL, as to the specific case example of Denmark in relation to the low death rate among the older persons. In relation to the comments, as we're talking about access to healthcare, there is also a need for palliative care, and also we need to pay more attention to employment and work for the older persons, especially in relation to Germany. And medical services, social relations, as well as LGBTI groups. Also, they're suffering age discrimination as well. We need to pay special attention to that, especially when it comes to healthcare, medical service. if there's any age-friendly programs, what are they? That would actually help us in this pandemic situation. So these are comments. And I think they will be taken up for discussion again tomorrow as well as the day after. So 2 supporters gave us questions, and there was a request for the Danish speaker to give us further clarification on your case example. So perhaps we can hear from Nena, MONRAD, BOEL on the Danish case example.
So regarding the question on the case numbers for senior citizens in Denmark, I was not comparing to other countries, but what I mentioned was that despite that our senior citizens from 60 years and up account for 26% of the population, that age group only accounts for 16.5% of the COVID-19 cases in Denmark. So meaning that they have a lower distribution of the COVID-19 cases compared to other age groups in Denmark. And the reason for that, I think, one of them at least would be the complete lockdown of nursing homes during the first wave of the pandemic. And that's where we need to, of course, that is very positive, but as we are discussing here today, we also need to see the other side of the coin and the consequences in terms of loneliness and the right to see family and friends, of course. There was also a question from one of the participants on social participation and methods for that. And in Denmark, as I mentioned, we had the Red Cross who are organizing digital visits and aiming that at senior citizens, as well as this initiative called Phone Friends, which is also due to the pandemic, calling senior citizens and having these conversations to combat loneliness. Then we've also had from our health authorities side, we've had some recommendations on how we can be together with our senior citizens during the pandemic, how we can keep a distance and see our family who are senior citizens in a safe way during the pandemic. Thank you.
예, 감사합니다. 그럼 이어서 한나 베커
Thank you. I would like to ask Ms. Hana BECKER to comment, please.
Yes, thank you. Yes, isolation, especially of elderly people, was also seen in Germany and was also treated as a problem. But we have similar measures, like my colleague of Denmark already talked about. So there were hotlines, so-called lifelines, for people could call and talk to people. This was the bottom line for the time when there was a lockdown and visiting services were not possible. There are also established visiting services, and of course, as I refer to the project Digital Angel, which kept going during the pandemic to familiarize all people with digital mobile phones and applications, and which could help how they can participate in society too. Thank you.
감사합니다. 지금 조은호 참여하고.
All right, thank you. Now also Dr. NAMKUNG, who's with us online, and also to the 2 discussants, and also Mr. Dongwoo. Do you also have any comments to add or responses? Seeing no hand going up, perhaps it is time for me to wrap up. Given that we are already delayed by 5 minutes as well, and also depending on where you are, it is time for dinner or breakfast or time for sweet dreams, perhaps. So then allow me to wrap up this session before reaching the conclusion. So there have been many comments and questions. Perhaps some defy easy answers at this point. And also there would be continuous discussions into tomorrow and the next. So perhaps some of the questions unanswered today might be answered in the following discussions. And so I do hope that in the final report, we will also be able to contain the questions and the comments and the responses that have been delivered online as well in the report, in the final report. Now, COVID-19, now listening to the presentation and the discussions today, I once again realized that perhaps COVID-19 was a chance for us to bring to the fore the issues related to the older persons that have been bringing below the surface. So perhaps this is a good opportunity for us, and I do hope that for the discussion in this forum, starting from today, lasting for 3 days, I hope we will be able to derive good outcome, good conclusion. Once again, I would like to thank the speakers and the discussants, online participants, and the audience watching us through YouTube. Thank you very much for your attention, and with that, I conclude this session.
Thank you very much once again for the insightful session. So please give a big round of applause to our moderator, panelists, and discussants. Distinguished guests and ladies and gentlemen, this concludes the first day of 20th Informal ASEM Seminar on Human Rights of the Older Persons. Thank you very much for being here with us till the end, and I hope you all enjoyed today's seminar, and hope this will be the meaningful addition to our endeavors to promote and protect the human rights of older persons. And we ask for all of your continued attention and interest in this important global agenda. And to the participants who will be taking part in the working group discussion, please make sure to come back tomorrow. And thank you again, and have a good evening and afternoon to all. Thank you.